Hi, I'm Rachel Wall, founder of Inspired Hygiene, and I want to give you a couple tips on your notes today. And I called this asleep at the wheel. Are you asleep at the wheel with your clinical notes? So we have the advantage of working with practices all over the country, and we get the opportunity to look into their chart notes, and we help them with standardizing their notes across multiple hygienists and team members. We get an opportunity to give them advice on how they can refine and take their chart notes to the next level so that they are documenting what needs to be documented. And I'll speak to that in another video. But first, I just want to talk about being asleep at the wheel with your chart notes. So step one in waking up and making sure your chart notes are relevant is making sure you have a template. This allows all of your hygienists to have the same prompts and to not have to rethink every time they write a note on what they want to say, and it creates consistency. So that's the advantage of the template. The disadvantage of the template is that sometimes we just kind of go on autopilot and we're asleep at the wheel a bit, and the same thing keeps showing up in the template. Like you look patient after patient after patient, and the notes look exactly the same. And what we know is that people aren't exactly the same. So we need to make sure we're customizing the details of the notes in that template. So for example, if it says bleeding, right, bleeding colon, and that's our prompt, then I as the hygienist have to make sure I'm creating custom notes to accurately describe the amount and the presence of bleeding. Is it generalized? Is it moderate? Is it localized? And this is in addition to the bleeding that you're charting in your perio chart, right? So there's nothing wrong with having two pieces of documentation showing that there's active infection. All right? The other thing is where it says medical history, be sure you write something more than no changes or stable. Make sure you note there what medications are they taking. What are their risk factors? Because here's the trick. When you get to advanced documentation, you're going to start attaching those clinical notes to all your insurance claims. So when you have a patient that has diabetes and it's not well controlled, or you have a patient that's pregnant or is trying to become pregnant, now all of a sudden that becomes part of their record. And when you attach that to their claim and you're requesting reimbursement for periotherapy, for example, now all of a sudden the insurance company has a lot more information and maybe they'll make a better decision. So don't fall asleep at the wheel with your notes. Make sure you have a template. Make sure you're including customized details in that template. And this template's going to help you create consistency among all your providers and making sure you're documenting things the same. Take care. I'll see you next time.